My name is Madina Kane. I pursued the Global Health Honors Bachelor's degree, and my specialization was actually in health systems management and policy. So my practicum was with CARFA, the Caribbean Public Health Agency. This was during the pandemic. So we were sent off to Port of Spain, Trinidad, to actually support several units within the agency. My focus was with the resource mobilization team and partnerships team, and that unit was kind of placed right under the executive director. Thankfully, we were in a position where we could actually speak to coordinators, and she actually came up with the idea of going to Trinidad. Being in a setting of global health and wanting to work on developmental issues, you really have to push yourself a little bit to step out of that box of comfort and really looking at the experiences that happen, not just at home in Canada, for example, but around the world. So that's really what pushed me to go for this particular location for the placement. A big concern that CARFA had was looking at the communication around COVID-19 within the region and looking at what miscommunication may be, circulating about the actual virus. Are people really understanding COVID, how to protect themselves from COVID? So the project that I was then set up to support was creating different communication documents that would be shared within the region. And what was so interesting is that in this particular context, the issue was around WhatsApp, right? WhatsApp was so heavily used in this culture, in this community, and it was also easy for people to spread misinformation quite quickly. So we had to think collectively, how could we best address this? And this was done by creating really cool and fun infographics that would be shared on different WhatsApp networks and groups. So I think this is just all to say that given the local context that we were able to learn and observe through experiences that were shared with us from the different CARFA colleagues, we were able to kind of better tailor the communication materials that we were creating to help address that public health challenge. So in terms of primary roles and responsibilities, a lot of the projects that I supported with would pertain to my ability to, write reports, compile relevant information through research, providing support on drafting different profiles. And essentially all of this information was later shared with the executive director for the organization, who would then be participating in different high-level meetings, whether it was the World Health Assembly. So this was really important because I had to be quite timely in my response in delivering these items to the team, but also being careful on the actual content. Luckily enough, we were in Trinidad at the time of Carnival, so not only were we working for a really amazing agency and doing really great work, but we also got to connect with the people in Trinidad in such a meaningful way, because Carnival is a time that really celebrates, emancipation for Caribbean people. So I think that looking back at it feels the most rewarding overall. I think the Global Health Program is so unique and it's so special. We really took the time to cover almost every possible understanding and aspect of global health and just global public health that you could imagine. I think when it comes to, considering practicums or just careers in global health, don't be afraid of taking on experiences that might seem scary at first or might seem a little intimidating at first. Like I said earlier, it's really just about developing you as a professional and as a person so that you could do the best work possible within the scope of global health. It's one of those things where when you're really, really young, you don't realize how impactful that experience is. But looking back at it, you see how much of it's really affected you as a person and how much of it has actually helped you grow as a person, as an individual. And I see that in myself now, almost 4 years later. So I think just overall, I'm really grateful that opportunities like this do exist at York University. So I think overall, that's what I kind of take with me, and that's what I'm always reminded of when I think back to this experience.